Hello, everyone. How's everyone doing? Good, good. Thank you for La Roche for sponsoring tonight's event. My name is Bobby Buka. I'm a dermatologist in New York City. We run the largest dermatology practice in New York called the Dermatology Specialist. I'm going to be doing two things today over the next 10 minutes. One thing, trying to debunk a lot of the myths that are pervasive among my patients. And the second thing is make a controversial case as to how wrapped up pop culture is with patient sunscreen use and sunscreen trends. It would have been wonderful to be a dermatologist in the 19th century because we didn't know very much. We certainly hadn't put together that sun exposure equaled skin cancer. And so back then, tan skin was connected with spending long days in the sun, and it was not bougie at all. So if you went to a park like this George Seurat painting that sits in the Art Institute of Chicago, everyone wore parasols and they had wide brim hats, and this is a dermatologist's dream. Unfortunately, no one goes to the beach or the park like this anymore. All this sort of changed when the Duke of Westminster started courting Coco Chanel in 1923. And the story goes, and I don't think Coco Chanel should be blamed for all of this because at the time, Marlene Dietrich was also turning up the contrast on her black and white movies to make her skin look a little tanner, and Mary Pickford was doing the same thing. But the story goes, the Duke of Westminster courted Coco Chanel for many months and finally convinced her to get on the Flying Cloud with him, which was his boat, that went from London all the way down to Nice. And the paparazzi all got wind that this trip was happening. And when she got off the boat, you can see very little sun protection on the top deck of that boat. She was super tan on that bottom picture compared to very pale when she started the trip. And one of the well-known princes, I don't know, Clements, do you know this prince? Prince Jean-Louis, wrote in his book, the best titled book, Best Parties of the 20th Century. He wrote, I think she may have invented sunbathing. At that time, she pretty much invented everything. So I'm thinking of sort of like a Taylor Swift of the 1920s. And so, as Janet mentioned, the first L'Oreal sunscreen was Eugene Schuller in 1936. There was a erstwhile mountaineer / chemist that was Swiss that came a little bit before him in 32 and had this sort of zinc toothpaste consistency sunscreen that didn't go anywhere. And so the first commercially available sunscreen was invented by Eugene Schuller and was a L'Oreal product. And that's less than 100 years ago. So it's fascinating to me that we can track the progress of sunscreen use. And what I'm going to try and do tonight is link that to popular cultural trends throughout the many decades. And you can see that sunscreen wasn't really adopted, and we don't see a nice slope of the curve until the 1980s, right? It was a slow starter. And most of the screens at that time were tanning oils that were meant to accelerate your tan and make you look bronze. So all these ads from the 40s and the 50s and the 60s and even the 70s, how do we get bronzer? And then Spicoli came. For those of you who know Sean Penn, he made Zinca famous, which is this really thick white paste that you put on your nose, and it was cool to wear Zinca. Everyone's can't believe that. I'm getting looks of credulity. Yeah, it was actually cool to look like that. And then came the three Gs, grunge, goth, and geek, with Nirvana, Marilyn Manson, Napoleon Dynamite. Broadband replaced dial-up modems, so people were spending a lot more time inside, right? And so we found the aesthetic shift more towards this paler look. One thing that fell off my slide here, which is super important, is the Baywatch era. So there were 241 episodes of Baywatch in the 1990s. Of those 241 episodes, 190 featured sunscreen use. And it became very popular to wear sunscreen, even if it was thick, sort of pasty sunscreen that no one would consider using today. Then it's really interesting what happens, because now we're in the last 2 decades. These curves really flatten, right? And we sort of hit this asymptote where we can't get past 70, 75%. And when we look at high school students on the right side, this right curve, they're also sort of flattened. So it doesn't look like this curve is going to change much when these high school kids graduate and become adults. And this is a census of 300,000 patients, so it's a well-powered census. And we looked at this is usually or always use sunscreen. And so when you go outside on a sunbathing activity, and so the 75% is a fairly decent number. And I think the glass half full approach to that is, well, 30% of adults floss daily, and 30% of patients have a primary care doctor they see annually. So maybe 75% is pretty darn good. And the other flip side may be like, well, we've hit the ceiling in sunscreen use over the last 2 decades. How do we get over that hump and encourage better usage so we can get that closer to 90%? And our challenge as dermatologists and industry with L'Oreal and tastemakers, you guys, is how do we dispel myths to educate and improve use? How do we advance the technology? Things like Celox, which adds antioxidants to our sun protection, which is huge. The dry touch technology that L'Oreal's come with, which makes it very easy and facile to put the sunscreen on so you don't feel like you've got sticky stuff on your face. The Mexeril, certainly the first broad spectrum chemical sunscreen, huge in terms of disrupting this industry. And then getting this cross-cultural buy-in. What do I mean by cross-cultural buy-in? We did a piece a few months ago featuring Haley Beaver. She says she uses this product for tanning, but is it even safe? The number one ingredient in that product is paraffin, which is a petrolatum hydrocarbon. It's just like oil. It's a photoaccelerant. And so we have these tastemakers, we have these mega influencers pushing photoaccelerants, which is going to lead to skin cancer very, very quickly. Why is that? When we poll the public, we see that our traditional sunscreen is toxic at all to your health. This number is rising. People are starting to believe that using sunscreen can actually be harmful to us. And this is a really dangerous myth. And one that I encounter every day in my practice. So one of the things I want to highlight is some of the myths, that the biggest ones I get, and how we address them, and how I hope you'll, in your influencer world, address some of these myths along with me. Number one is, oh, but I'm never in the sun. And fascinating data shows that ambient, unintentional sun exposure, you're not headed to the park, you're not headed to the beach, you're just walking around on a normal day. 95% of that sun exposure happens during those times, not intentional sun-bearing trips. Number two, sunscreen causes cancer. Just not true. There was a really unfortunate, I put a little footnote here, there's a really unfortunate study that was done where they looked at latitudes over 50 degrees latitude, which is like the New Brunswick, Greenland area. And they found that they couldn't decrease skin cancer if those patients used sunscreen. I'm not sure what the outdoor activity was of our Greenlander or our Newfoundland friends, but the preponderance of data points resoundingly in the opposite direction, that absolutely you're seeing lower skin cancer rates with all forms of sun protection. Sunscreen is a metabolic disruptor. This one I had to give a little bit of credence to. Oxybenzone, which L'Oreal's is phased out almost all of their products, and octinoxate, now banned in the EU and in Hawaii, is not safe for coral. And there was some data to suggest that maybe there was some testosterone impact with those two ingredients specifically. Now, the problem is that oxybenzone is in plastics. Oxybenzones are in aftershave. Oxybenzones is shaving cream. They're in shampoo. So I can't really tie that to sunscreen necessarily, but yes, I would certainly look for a product that is oxybenzone and octinoxate free. Next, I have skin of color. I don't have to wear sunscreen. The most famous skin of color icon to die of melanoma. Anybody know? That's very good. Yeah, that's good. So squamous cell is certainly more common in skin of color. Next, basal cell carcinoma, and then finally melanoma. It's winter. Why should I wear sunscreen? It's true. 40% of your ambient exposure is going to come during summer, 35% in spring, but nearly 25% occurs during those colder months of winter and autumn, right? And for every 10% I decrease that exposure, I get a 2x decrease in my lifetime skin cancer risk on the odds ratio. So even during those autumn and winter months, super important to wear sunscreen as a daily use. Finally, I need sun for vitamin D production. Yes, it's true. You do need UV activation to activate your vitamin D, but that can be done with 3 minutes if you live somewhere near the equator. It can be done in 20 minutes if you're in New York or Boston. And yeah, back to Greenland, if you're up there, it takes about 15 minutes. So if you wanted to wait 5 minutes before you put your sunscreen on, you could, or use your sunscreen every day, and enough is going to get through to activate the vitamin D that you need. Thank you so much. We're going to open up to question and answers. Janet on the science side and myself on the clinical dermatology side. Hopefully we can dispel some myths together.